You're listening to Up on Medicine with Jeff Levy, Bonnie Jane Bentley, and Dr. Ronald Belsick, right here on LA Talk Radio.
It's showtime. This is a show we call Up on Medicine. And I'm Jeff Levy. I've been called the digital doctor, but I give lectures to groups of doctors for their continuing medical education. I'm thoroughly versed in billing because when the billing systems go down, the income, well, you understand. Yeah. So I do a lot of that. I also do a lot of consulting about hardware and software. And I do this show with my two best friends who are my partners. First,
Bonnie Jane Bentley.
The beautiful, inimitable, indomitable, creative Bonnie Jane Bentley, who's a caregiver.
Yes.
And a volunteer.
Yes.
And you've been a biofeedback therapist.
Biofeedback,
hypnotherapist.
Yes.
Hypnotize me.
I have.
How
do you think I got on the show?
Yeah. You know, I wondered how that happened. Yeah. Look, we'll keep you up to date on the latest in medicine and health news. All the technology, the doctors, our special guest tonight, Dr. Sunny Bhatia, who's an incredible doctor. You want to talk about credentials? Wait.
Oh, boy.
Knock you out.
Oh, boy.
Thank you.
And if you want to email us with questions, just send your emails to uponmedicine@yahoo.com, or you can call us, area code 844, don't worry, it's toll-free, 339-JEFF.
5333.
339-5333. And be sure to listen to the show that follows, Turn On to Tech. We have some amazing things.
Oh, yeah. I'm going to put on my headset.
Oh, the headset?
The iGrow headset with the red lights flashing and everything.
I want to mention one thing. Bonnie, you were using AT&T for your internet provider.
Yeah.
At $120-something bucks a month for a landline and internet. I don't want to hurt your feelings, hon, but it was so slow.
It was dumb.
I could walk to the internet faster. So we threw all that out, and we got you
DSL Extreme.
Now you've got 3 times the speed and a landline for $34.95 a month.
It's incredible, and it's so fast.
Well, Bonnie asked me if we could put seatbelts on her chair. It's really, really fast. And Dr. Belsick.
Hello, San Fernando Valley, Los Angeles.
And world.
And world, right. I'm a reconstructive foot and ankle surgeon. You can find me at Sherman Oaks Hospital. I specialize in amputation prevention. And as you know, Sherman Oaks Hospital is part of the Prime Healthcare family.
Which we love. Yeah, that's a great family. I saw a patient of yours who came from Qatar. And I watched this man walk for the first time in 7 years. I got chills, Doc.
Yep.
Yeah. When I shake hands with you now, I feel the energy.
The doctors, the miracle makers. Huh?
Absolutely. Yeah. All right, let's get rolling so we can get into the show and then bring Dr. Bhatia in. We'll start with In the News.
Yes. Okay, the first item is hand washing at work. Some studies show you better think twice before you shake hands with a coworker because only 10% say they only wash their hands sometimes after they use the toilet, and 1% say they never wash their hands after using the toilet or any time during the day. Okay, so some even eat in the restroom and use their cell phones in there, and I've heard them.
I've heard that. I heard a guy wish his mother Happy Mother's Day from a bathroom. Yeah,
that's gross. You don't know what she's going to hear. Anyway,
honey, what's that noise in the background? Oh, it's a cannon, Mom. They're shooting off cannons.
Right, for your birthday.
Yeah.
Yeah, 13% preferred to use the company restroom instead of their own bathroom at their house, which it's probably cleaner.
Yeah.
Okay, an ambulance drone. A 23-year-old Belgian student, Alex Momont, came up with an idea for his graduation project of a rescue drone or ambulance drone.
Must be a big drone.
No, it's not. It's
small.
Small.
What does it do?
It actually can carry equipment and live video instruction for someone to use it to the scene of an accident or a medical emergency so that they can perhaps save a life before anybody can get there.
I think I heard, you told me something about a drone that's very special. I don't think we're going to talk about it tonight, but we will, maybe next week. Starts with the letter D.
I have no idea what you're talking about.
Defibrillator.
Oh, no. This was the one that can carry the defibrillator.
Okay, so there's a defibrillator on a drone
with the instructions, how to use
in
it on
video and how to use it. What do you think?
Great idea.
That's an idea. Okay, go.
Okay, 40-year-old mother giving birth had no pulse for 45 minutes, was on a ventilator for 3.5 hours before coming back, and she was fine.
And you know what she gets for breakfast? Anything she
Anything
wants.
she wants,
Yeah.
you know. But she said she had a glimpse of the afterlife and saw her father and spiritual beings, and that she was flowing through, and it wasn't frightening at all, which is kind of nice to know.
Well-
And in fact, we're going to be reading a book about that by a neurosurgeon.
Yeah, we are.
Yeah.
Let's ask Dr. Belzik. Under those circumstances, would you really expect somebody to recover?
No, I wouldn't.
And let's ask our cardiologist.
Yeah.
Yeah, unusual. I think what she has going for her is her age. But someone who would be much older than that, that would be practically unheard of.
Wow.
Well, the book is
Well, it's
called.
like these people, they get frozen under the ice, but at least they're frozen. I mean, you know, I mean,
It slows.
and-
It
and
slows everything
the
down.
hypothermia.
yeah.
Uh-huh.
So the book is called
Proof of
Heaven. Right?
yes.
All right. Let's go on.
Okay, so this neurosurgeon thought it was funny when patients would tell him about this and went, until it happened to him.
Yeah.
Aha.
Interesting. Okay, federal 6-month cod fishing ban. You might want to go not eat codfish for a while. From Massachusetts all the way up to Canada, officials say that the cod is in danger of being wiped out. And the fishermen are upset and outraged, but the cod need time to reproduce. So
You have to coddle them.
eat something else for a while. You have to cuddle them?
Coddle.
Coddle them.
Yeah, the cod.
Okay.
All right. See
Okay.
how it is, Doc? We have fun.
Yeah. Good jokes.
McDonald's is recalling their Hello Kitty birthday lollipop whistle. Children can choke on the pieces. They gave out 1 million.
1 million. And they're recalling them?
Yep.
I guess
Oh.
General Motors isn't alone.
Yeah. So Doc, you're going to continue in the news, aren't you?
All right, continue in the news. So let's talk about tobacco products. 1 in 5 teens use tobacco products. 90% of them smoke cigarettes, cigars, hookahs, or pipes. The CDC, Center for Disease Control, predicts that 5.6 million kids are at risk for early death from tobacco-related illness.
That's awful.
Isn't that amazing with all of the publicity that's out there on it? But I guess they do it to look
Cool.
big and strong. I mean, that's why I tried it in junior high school.
Bonnie, have you seen some of the commercials of people who have holes in their throat?
Oh, I have. I
And
have.
their teeth are rotting
Yeah,
out? Oh,
yeah.
my God.
Sad.
Okay, Doc, let's roll.
Smokers and back pain. So what do you want to know about this? So smokers
Everything.
are 3 times more likely to have chronic back pain. So a study
Why?
looked at the brain activity of smokers and non-smokers. The brain processes pain differently. So smokers are less able to tolerate pain. So maybe stopping smoking could potentially alleviate this.
I know smoking's
Okay.
very bad for diabetics.
Well, they're saying they do have proof that it does seem to reverse it if they just stop. So
Well, the
that's
problem
good.
for diabetics is that smoking constricts blood vessels.
We see a number of diabetics who also smoke, and so their pattern of vascular disease is much worse. So diabetics usually will have constriction or calcifications of arteries below the knee. Smokers will have it at the abdomen or femoral arteries.
Whoa.
So can you imagine both areas being affected? Very dangerous,
Well, now you've got another thing in your arsenal to get them to stop if they're having any chronic pain.
you would think.
You would
You
think.
hope- yeah, but it
I
is
hope so.
an addiction.
Gets their heart too. That's bad combination.
Exactly.
Yeah,
yeah,
we'll talk
yeah.
about that, too. What else, Doc?
German pill swallowing study. So if you have trouble swallowing pills, there may be an answer. They tested they tested both large and small pills and capsules. 2 ways worked the best. Number 1, the pop bottle method.
Which is?
So this means you put the pills on your tongue and take a swig.
Okay, so you put your
Jack
mouth around
Daniels,
the bottle and yeah, go
whoa.
for it.
Number 2, you do the head tilted forward method. You put the pill on your tongue and take a drink of water, tilting your head forward as you swallow.
So most people jerk their head back, they go,
Backward. Yeah,
and that kind of blocks the throat then. It doesn't
Exactly.
go down as easily.
that's a good one. Got more?
I do. So everyone is talking about the Ebola vaccine, and there's an Israel drug company that has come out.
Oh, That was going to be mine, but you might as well go ahead because we're going to get rolling.
Okay, well,
Leave it to the
I
Israelis.
thought we were going to introduce our doctor and do our segment
yeah,
with the
yeah.
doctor first before we got rolling.
Okay, I think it's time. Doctor, we are so
Yes.
pleased that you joined us. You
Yes.
are a very busy man.
Oh, thank you for having me. It's a real
And you're
pleasure.
kind of a legend in your own shoes. It's amazing. Bonnie, you want to give the curriculum vitae?
Oh my
the
gosh,
background?
does
It's
it
a
ever
lot.
end? Dr. Bhatia is they call him Sonny. What's your first name?
Sandeep is my full name, but
Sandeep.
Sunny is what
Okay,
I.
but it's
yeah,
nice.
I go
It's
It's more
nice.
fun.
Yeah.
Sandeep. It's very deep. Yeah. Okay. Yeah,
All right,
okay.
go.
Okay, Dr. Bhatia is an international interventional cardiologist who is a quadruple board certified.
How
in-
unusual.
Wow, with internal medicine, cardiovascular disease, nuclear cardiology, and interventional cardiology. Wow. Okay, he received his bachelor's degree at the University of Pennsylvania, medical degree at University of Minnesota Medical School, and completed his internal medicine residency at Mayo Clinic.
Which is rather prestigious, I would
Yes,
think.
I would say so, in Rochester, Minnesota,
Yep.
where he received an Internal Medicine Outstanding Achievement Award.
Way to go, Doc.
You're too young to have
thank
done
you.
all this. Okay. He's a fellow at the American College of Cardiology and the Society for Cardiac
Angiography.
Angiography and Interventions. He has authored numerous publications and has presented his research at national and international conferences.
Do you hear something?
I'm afraid it's my phone.
Oh, well, why don't you go?
I'm not going to answer.
Just leave it.
I'm leaving it. Okay. We forgot to remind
Hope
each
it's-
other to turn them off.
I hope it's
okay.
not your dad.
I'll check in a minute.
All right.
Okay. He is the Chief Medical Officer at Sherman Oaks Hospital and Encino Hospital Medical Center, and he's also affiliated with Valley Presbyterian Hospital and Centinela Hospital Medical Center. When do you have time for all this, Doc?
Yeah, I don't know.
I know.
Well,
when
hearing about all
somebody
this.
else reads what you do, you go, I guess I did all that.
So
Okay.
now you know why we're so happy that
Yeah,
you
no,
took the time
it's,
to join Dr. Belzik
You
and
become
Bonnie
more
and me.
efficient as you get older. I think that's
Yes,
probably.
and he's also involved in charitable causes, including World Children's Initiative and Uganda Heart Project for cardiac care of children with congenital heart disease.
Yeah. Actually, a big
Wow.
event tomorrow for that we'll be attending, so it's exciting.
What would that event be?
It's another fundraising event to support efforts to take care of these
Outstanding.
kids in Uganda.
All right, let's get right into it. Bonnie, you want to
No,
check your
you go
phone?
ahead.
That'd be a
I'll
good
go
time
check
to do
my
it.
phone. See ya.
Doc, you've worked with Dr. Belzik.
I have,
Yeah, and because I've seen you in his office.
yeah,
He is a miracle maker, too.
wonderful physician.
Yeah. I got to call him Legs for short because he keeps people from losing them.
Yeah.
So tell us about your practice.
Yeah, so I've been in practice now for 5 years 5 years in December at Sherman Oaks. My practice consists of both outpatient and inpatient evaluation. My interest is in interventional cardiology.
Which I'd like you to explain.
Yeah, so that's think of it as being the plumber. You know, if there's blockage or plaques in the pipes, we go ahead and try to fix those. Similar to what if you had a blockage in your legs, a vascular surgeon would take care of that. My focus is on the heart, and so if there's a patient with chest pain or a heart attack, we'll go ahead and evaluate, look for the blockage, and if we can fix it, we'll go ahead and fix it with a balloon and a stent.
It's called an angioplasty.
Angioplasty, exactly.
Do you also use for a better choice of words, the Roto-Rooter technique?
Roto-Rooter, yeah. I
They
knew that
actually
question
do
was
that in
coming
the
up.
arteries. Tell me about that.
Yeah, so that was it was some technology that actually 10, 12 years ago thought that could cure everything. You have small little plaques, you can wipe them out and suck them out. The study and the studies didn't really support that being to have the longevity in terms of improving outcomes. So that still we use it to help us deploy our stents, but it's an adjunctive technology.
Okay, so it's an add-on. So I can see cases where you would work with Dr. Belzik because the problems with the heart are exacerbating the problems of circulation in the lower limbs, right, Doc?
We do many complicated procedures, and before we can proceed, their heart needs to be strong enough before having a general anesthesia.
So they see Dr. Bhatia first.
Exactly.
Okay, Doc, cardiovascular disease awareness, is that coming up? Are people just ignorant about it, don't know? What's the situation?
No, I think the level of awareness has improved. I think we have heart months now, women and heart disease. I think we're aware now. Now it's a matter of getting, doing the appropriate intervention. We talked about smoking earlier today. That has to be on the downside, and there's some general improvements, I think, in terms of awareness. And with awareness going up, improving your diet and exercise, not smoking, getting treatment for your high blood pressure, high cholesterol, that's what's improving. And then with those improvements, we're seeing patients live longer, live healthier, more functional, and it's actually making our procedures more complicated, because by the time they get to us, they're not in their 60s anymore. They're in their 80s and 90s.
Wow.
Because they've done so well with medical therapy. So our interventions and our procedures become a little bit more challenging.
How
for that
interesting.
reason.
I was impressed, Bonnie, with the statistic you had that 1 in 5 kids are smoking. That used to be a lot more than that. It used to be much more prevalent in high school kids.
Yeah.
It would have been 3 out of 5, maybe.
It's still sad that it's that high, though.
Well, yeah, but it's
my
come
gosh.
down. It's come down. Open heart surgery, where you literally go in and crack open the ribs, open it up, and get to the heart. Are we still doing that?
They are. Surgeons still have a job. They're still doing these procedures. But actually, the frequency of these procedures has gone down.
Why is that?
Twofold. One, the medical therapy has gotten better. The awareness has gotten better. The lesser invasive or minimally invasive techniques has also improved. So the patients now that get to these surgeons, again, have either failed medical therapy or aren't candidates for the lesser invasive procedures like a stent. There's still good data that says surgical intervention works, that it's good technology. But I think the fact that people are aware that the medical therapy is improved, we're seeing a decline in that.
And maybe they're not so afraid to come in, too. And
When they
get
know they're
things
not
done
going to go through
earlier.
that.
Right.
Because they'll have a permanent, they call a zipper, which is
Yeah.
a scar from here down to your navel.
Yeah, and we as interventional cardiologists, we like to put in stents. The surgeons like to do bypass, but the truth is, some of the data does support bypass over stents. It hurts to say it, but it does. But now we're finding that there's some cases that you might be able to go one way or another, and
it's preferred to do stents.
and a lot of patients prefer to do the stenting approach because they can walk off the table and go home the next day.
I have a friend who had a valve go bad.
Yeah.
And the valve was replaced through his groin artery.
My mother had her angioplasty through the groin
Yeah.
as well, because they
Me
couldn't
too.
even get in through. Well, wait a minute, not through the groin.
She did it
She
through the
did
arm.
it
Could have been through the arm, yeah.
because they couldn't get through. Her veins were so clogged up.
Right.
Well, how do you put a valve through a vein? or an
Yeah,
artery?
actually, yeah. So through an artery. So it's interesting. You mentioned percutaneous valve replacement. Now, the conventional or the first type of valve that was worked on was the aortic valve. You think about aortic stenosis or narrowing of the valve. That tends to be a disease of the elderly, and those patients a lot of times are written off and say they're not a candidate now. They're either too old or they're not stable for surgery, and those patients were left with just very few options and very poor quality of life. Now with, we call it TAVI or TAVR, it's a minimally invasive through the leg where they have a valve deployed over this catheter. It gets into the heart and they speed up the heart really, really fast, and they're able to position the valve appropriately, deploy it. And initial data is very, very promising. It's been approved from the FDA for the more complicated, high-risk surgical patients, but we're starting to see that it might be an option for those patients maybe not as complicated because the outcomes are so far good. But
Yeah, they're not going to have to be under anesthesia for hours and hours.
right, the
and with-
procedure is shorter. It's usually done in tandem with a surgeon. We have a few tertiary centers in Southern California that do an excellent job, and the outcomes we've seen has been fantastic. And to take it one step further, now there's 4 valves in the heart, but another valve, the mitral valve, which can be very leaky and need
Oh,
to
yeah.
be
That's a
repaired.
Yeah.
They can do a similar technique through the leg as well.
So
Wow.
the valve is small enough to fit through an artery, or is it kind of compressed?
it's compressed, and
I'll
then
bet.
they deploy it over a balloon, if you will.
Wow.
It's amazing technology.
So, what are some of the other technologies that we should know about in the area of interventional cardiology?
Yeah, I think the biggest leap right now has been on the valve side. Stents, the technology with stents has improved.
Stents themselves are improved.
Yeah, those have improved, and I think we're getting into an era of now biodegradable stents. Which,
What?
yeah, so you'll deploy these stents. The problem with some of these other stents is you need to be on certain medicines for a long period of time. These stents don't always work, and there can be some complications afterwards. Not very common, but it's still a possibility. The biodegradable stents perhaps will give you longer, good outcomes for a longer period of time, and perhaps you don't need to be on certain medicines for as long of a time.
Well, if the
as well.
stent,
Is it dissolving
Over
over a period
time,
of
yeah.
time?
well, then will the artery stay open?
That's the thought, and that's what the data is showing. Now, the stents
Oh,
that
good.
we put in now, the drug-coated stents over metal, the way I tell patients, this is going to become part of your body. It's embedded in the wall, and the tissue grows over it, and it becomes part of your body, but your body won't recognize it as a foreign object because it's healed over.
Nice.
Ah, okay.
Dr. Belzik, you have patients who will need stents in their legs.
Exactly.
Not the heart. So that kind of technology could also be used.
Yeah, same philosophy, I think, with peripheral vascular disease.
Bonnie, didn't we talk about a pacemaker that is not implanted in the chest, but rather through an artery and attached directly to the heart? Have you heard anything about that? I don't think it's in use, but I think it's in trial.
Yeah, we're getting into lesser invasive types of pacemakers and defibrillators. It's a fairly safe procedure, but they're always looking at that next.
Well, it's
step.
painful. You've got a bulge. You can't wear a
Yeah.
seatbelt for 3-4 weeks. And you have to be very careful if somebody hits you or you bang into something.
Yeah, and there's ways now that perhaps implanting such devices and actually putting the leads in doesn't have to be as invasive.
Well, the one we talked about, the leads go directly to the heart, and it's done through an artery.
Right. Yeah, and actually,
Crazy.
yeah. No, it's amazing to watch and to see how these patients.
Well, I know
improve.
Bonnie has some questions, so I'm going to ask my last one. What do you tell people to do for heart health?
You know, the biggest thing for me is to focus on lifestyle. I think, we as doctors love to prescribe medicines, but medicines have side effects.
Oh, yeah.
There's complications with it. They're expensive. They interact with other medicines.
Mm-hmm.
So the easiest thing to do is live a healthy lifestyle, diet and exercise. Exercise.
The easiest, maybe
Well,
not for some.
Yeah, I guess the least costly, hopefully, and also from a complication standpoint, if you can, but consuming a very sensible diet, if able, exercise 3 to 4 times a week,
So
30
it's
to 45
lifestyle.
minutes.
Yeah, just get healthy.
And stop smoking. Smoking, if you're able to stop within 2 to 3 years, you've essentially reversed any risks that you were exposed to from a
Wow.
cardiovascular standpoint.
I'm so glad
So
I
it's
don't
never too late.
smoke.
Yeah.
You mentioned the drugs with the side effects. I'm just going to throw this in, and then I want to hear your questions.
Okay.
When you watch the commercials on television about these side effects, if you notice a decrease in vision or hearing, call your doctor. Well, hell, if I can't see the phone and I can't hear him
Can't hear him,
anyway,
yeah.
well, I don't get that. Well, that's crazy. And then if you have another condition for 4 hours, call 911. We'll leave it at that.
Yeah,
Well,
yeah, I think so.
okay.
I have just something fun. We were discussing doctors' personalities, and that different specialties seem to have different types of personalities, and that it either attracted those personalities
Right.
into those, or the specialty itself created those personalities. It's like my friend is in infectious disease, and he's really like a Sherlock Holmes of
Yeah.
medicine, searching around for things.
Right.
And it's like, so we were wondering, what brought you into the field of cardiology?
Yeah, it's the thing about cardiology that I really love and and enjoy is that you get that continuity of care with patients in your clinic. You get to build those relationships, that physician-patient relationship that I think is so important. And on the other end, you still get to be use your hands and be in a lab and think on your toes and be a proceduralist. And I love acute care. I like taking care of sick patients. There's nothing more gratifying than someone who's about to die from a massive heart attack, and you can go in and you can save them. And then you get to follow them in your clinic a week later and meet the rest of their family.
Wow.
And
Great stuff.
Well, you know, that's what this doctor friend of mine was saying. He was saying that cardiologists and neurologists were like the gods of doctors, you know.
I won't go that far, but I
but
think
you know what I mean?
yeah.
He was saying because they
Yeah.
have such power, because you really do have the power of life and death, and you can save lives all the time.
I'm curious, Dr. Belzec, how did you get into being a reconstructive podiatric surgeon?
You know, I had many mentors in my training programs, and I just really looked up to them. And so I followed in their footsteps. I always liked fixing things. I always like working with my hands. And that's what I do. I break things, fix them, and I can think out of the box sometimes to help.
Yeah, you do. You
save
really
lives.
do.
Mm-hmm.
So, Dr. Bhatia, we really enjoyed your company. You're welcome to stay with the rest of the show and pipe in, or if you have to leave, we'll understand. But before we do that, let's tell people how to find you.
Yeah, so my office is in Sherman Oaks on Van Nuys Boulevard, 4940 Van Nuys Boulevard.
I know that building. It's right by the hospital.
Right across the street from Sherman
Yeah.
Oaks. So, yeah, we're there and happy to help anyone that needs help and cardiovascular consultation.
What about a phone number?
818-528-1260.
Thank you very much.
Yeah,
Please
thanks, Jeff.
stay if you can. If
I
you
will.
can. Oh,
Yeah,
good.
thank you.
All right, so we
Good.
were talking about Israel, Dr. Belzec. They're going to be putting out the Ebola vaccine, and apparently we can't. How does that happen?
Let's see. Tell me about it, Jeff.
Well, you know, we've lost close to 4,000 people from Ebola. But the ones that came here all survived except one, because I think the hospital mishandled him. That's my opinion. But the World Health Organization hoped to have a vaccine by this month. But ZMapp is the drug. It's very difficult to make. And this company in Israel says, well, we have the capacity, and we're idle in some ways, so we're going to do it. So I think that's a big deal. I think that's a very big deal. Now, let's switch to something closer to home.
Oh, the dangers of detergent pods. You know, I've
Wait till you
been
hear
tempted
this.
to buy them myself because they're convenient. You don't have to pour the detergent or whatever. But these pods are being mistaken for candy by small children. And they're being eaten. Every hour an emergency call is made to poison control with this hazard. So the Journal of Pediatrics reports that in just 2 years, 6,000 children were sent to ER and more than 17,000 calls were made to poison control. The children can't tell the difference between the look of candy and the look of the pods. They're made very bright and colorful.
Yeah.
Okay, so kids, that have grabbed these and tried to eat it were often under 3 years old, and many have been put in a coma. So nearly 100 were put on a ventilator, and one child died.
How sad.
Yeah, the containers are really easy to open. On ABC News, they found that the kids could open a candy wrapper in less time than they could this container. They could get into the container quick. The candy wrapper was complicated.
No, so they could open the pod before they could open the Snickers bar.
The container that holds
Kinda
the pods.
scary.
And then it's supposed to be child resistant, but a young child opened it in about 60 seconds.
Wow, smart kid. Well, here's one that might be helpful to you, Dr. Belzec. There's a new LED light bulb. You know, we've got these new light bulbs that people have to buy. And it's got something special going on. If somebody falls...
I thought Doctor was going to do this one.
Oh, is he? Okay, I didn't have it. Okay. Then I
So,
should have given it to him.
oh, no.
Talk about it.
Well, let me talk about it. So these,
Before you do, part of this is because
Oh,
people
you're
have...
going to have him do the next one. You're having him do the orthopedic. You
That's
do
what
that.
I thought.
Okay, I got confused.
Okay, so let me finish. Dr. Bhatia, you're going to love this. Union Tool Company of Japan developed a new light bulb that will monitor what's going on in the room below the light bulb, and it can automatically detect if some elderly person has fallen, and is trying to get help in a light bulb. The bulb has a little radar chip pointing downward that can measure the distance of the person's skull to the floor. And if that distance is reduced rapidly, it assumes there's a fall. And so it wirelessly, through the Wi-Fi of the house, sends to a service company and or your family. What do you think? Now, that's what I call cool. It will cover an area of about 142 square feet. Wow. So if you put it throughout your house, if you have elderly people living with you, it's a godsend, especially if they're home alone.
No, you're right.
Or even if they're in their room and you don't hear. Dr. Belcik, that brings something to mind for me. Broken hips. Do people break their hips when they fall, or do they fall because the hip broke?
Both, actually. So, some people will break it right at the femoral neck, sometimes at the, where it connects from the, we call the intratrochanteric process. The fractures sometimes can occur in the elderly when they are ambulatory and then all of a sudden fall down. Or it could be vice versa. They trip and then break it. So.
Or it could break itself and then they fall. How interesting.
Dr. Batya, if you want to jump in on
anything,
anything,
of these things,
jump in.
No,
join in.
It's unfortunate. We see so many this happens so often when these patients get admitted to the hospital. And sometimes they might pass out from a heart issue or something else,
and then
they fall and they break their hip.
Wow.
So it's an
not a good thing
occurrence,
for
and
the
it's
elderly.
a serious deal.
It really is. But the implants, orthopedic implants, wait till you hear this story, Doc.
So let's see. Traditionally, we use stainless steel or titanium.
Yep.
So this story is about implants that degrade and slowly dissolve. So a great deal of these implants
Like
need to be removed, or they're left forever in the body. So there's some disadvantages by leaving them in.
Extra
forever.
surgery.
Extra surgery is required. They can need another incision. There's other side effects, and then some people have allergies to metal. So very serious burdens. And researchers in Germany have worked on durable implants that degrade and slowly dissolve in the body for further secretion. These implants are made from iron alloy and beta tricalcium phosphate. So ceramic material. The iron degrades slowly, but provides enough necessary strength to maintain the structural integrity, while the ceramic breaks down faster and promotes new tissue regeneration.
Wow.
And
That's amazing.
Interesting.
the researchers are using a powder injection molding to combine the two into a solid technique that provides enough stability, adjust the density and porosity as necessary. So this technology may lead to personalized implants and breakdown in a slowly pre-programmed manner.
So that would work in your practice because you also implant rods and screws and plates and things like that.
That's right.
On the feet.
That's right.
Ooh.
So many times these hardware need to be anatomically designed because they're small bones, small joints, and this would be the next step.
And I'll bet they can print them with a 3D printer.
Exactly.
Yeah, those 3D printers.
Well,
They're
Dr. Badia,
amazing.
on a recent show, we talked about the fact that we soon will be printing organs. Okay? So you can print a kidney, but if you use material based on a person's own system,
Right.
then there's no rejection.
Yeah. No, it's,
Watch, they'll be doing hearts as well.
yeah, it's scary. Like how much technology is growing.
Yeah. Well, now let's talk about something that's not so technical. It's about
Okay,
sleep.
and aging.
Uh-oh.
Oh, two
No wonder.
things. One thing
I'm
we
actually
want, the
only
other thing we
47,
don't want.
Doc. I lived a hard life.
Yeah, but we want to age, but we don't want to age. Yeah.
Yeah.
Okay. You can use 7 to 9 hours per night, and it's a
please.
myth that you need less. You just get less. So, a cumulative lack of sleep leads to heart disease and other problems. It's one of the things in your lifestyle things that you were talking about. Okay, 42% of adults with a child under the age of 18 report that they don't get enough sleep. 70% of women are in the workforce and taking care of children. 55% of adults aged 35 to 54 have a smartphone near their bed, which disrupts their sleep.
Well, define near. I've got mine like.
That's near.
Okay.
Okay, unless it's totally off. And you're
Are
not going
you
to hear
kidding
any
me?
little dings or anything or little lights flashing on. Or
Well,
something.
we've had the conversation that you don't want to send me emails, after a certain hour because they'll wake me. I sleep right through the emails.
I don't know. I think subconsciously you're picking them up.
Yeah, maybe. Yeah, maybe.
Okay, so as you age, your sleep patterns change. And from the 30s to 40s, it's your lifestyle. That screws you up. I mean, they're out partying. Okay, 50s, your hormones start to slow down as well as not getting enough sleep at night. So if you're exercising at night, you have to move that routine till in the morning and check out your medications to make sure you're taking them at the right time of day, that they're not keeping you up or a combination of them. And then look into over-the-counter sleep remedies like melatonin and valerian root. Of course, checking it out with your doctor to see if it's good for your particular case. Okay, in the 60s, you start to see physical ailments as well as problems with lifestyle.
You
can
think?
have arthritis, that may be pain in your sleep when you turn over that might wake you up, or sleep apnea. A lot of that going around, especially because we have a society that has gained so much weight. All right. And then the 70s, you may be resting all day long. You're retired, you're not doing as much, and then you don't go to sleep at night. So get busy. Get out there and take your morning walk and get some things going. Now, 77% of adults have learned to value sleep more as they get older than when they were younger. Well,
Duh. Who are they talking about?
you're not moving as fast.
Yeah.
So, how do you get yourself to go to sleep at night? Well, you get yourself to go to sleep at night the same way that you get a child to go to sleep at night. You get them calmed down and wound down. And you've got to do the same thing for you. You turn off all of your electronics and
All of them?
turn off the TV. I know, I'm really bad with that. If the TV's on, I'm going to be up till 2. Okay, don't read on a tablet because that's that light that's shining. The LED lighting stimulates you, and then you don't want to go to sleep. Your pineal gland needs darkness, and any light's going to affect it, and it's not going to produce the melatonin that's going to make you go to sleep. So 30 minutes before bed, you want to read some old-fashioned material like a book or newspaper, and just set the time that you go to bed, just like you do for your child. You got to go to bed. It's such and such a time, and conversation's good. Electronics and televisions are not.
Yeah. Dr. Badia, when you have patients who don't sleep, what do you tell them?
Actually, it's a lot of what we just heard. A lot of it becomes sleep hygiene, and trying not to do too. Don't be watching TV. Don't be doing your work in
Bonnie
bed.
hit it.
So no, I think you're right on. And the one thing I wanted to say was mention about sleep apnea. That also plays a role in a lot of the things we talked about for heart disease.
Yeah.
And
Oh,
so
yeah.
it's just recognizing that if you're really sleepy during the daytime, it might not just be that you
Are tired.
are tired. You might have a real reason for it. So that would justify an evaluation.
Outstanding. Gotta sleep.
Let's go home and get a good night's sleep.
Yeah.
Yeah. Just treat
can't turn
yourself
my
like
phone
you're
off.
Well, I
I'm on
think it
call,
helps
that's
to
the
have some
problem.
kind of sleep ritual, like
Yeah.
that you do that in a certain order every night, so that it's kind of calming and put on a candle.
Thing is, there are some meds that will help you sleep, but
Melatonin.
No, I'm talking about prescription meds,
oh, yeah,
and
yeah.
they're very addictive.
Yeah, addictive, and there's some strange things that can happen when
People
you
do
take,
things in their sleep, Bonnie.
Oh,
They
with
get out and
Ambien.
drive a car.
Ambien.
Ambien, they
Ambien,
would-
Yeah, it's notorious for
Or
that.
they were having like a hangover the next day, and
Or they'll
like,
go out and drive their
until
car
noon.
and not
yeah,
remember
they're
it.
taking the kids to school.
They're
and-
sleep driving.
Yeah, it's not good.
especially Ambien, it makes you voracious appetite. I mean, you're just eating, and then that leads to different problems as well. So
Fix one, break another.
Oh, so you don't know you're up eating.
You don't.
Then you have to look around the kitchen and look for
no, you
hints
see
and
it's all over
clues.
your.
Where's that
pajamas.
20-pound turkey that was here this morning? Oh, my God. Well, let's talk about Microsoft for a minute.
Okay.
They're developing a navigation system that lets blind people go out and about without a seeing eye dog and without somebody at their elbow. They partnered with a number of organizations, charitable organizations, and they've got a system that harnesses the power of a smartphone and wireless beacons, and then they use bone conducting headsets. Now, we talked about Google Glass, remember? Mm-hmm. That does not have a microphone or a speaker. It uses your skull to do that. So this is that same technology. So the beacons are used by the smartphone to know where the person's located and what is around it. The headset produces sounds that helps the person hone in on a destination. And the system is actually being tested up in London right now. But it's an amazing thing. A seeing eye dog is a companion that will keep you out of trouble. This thing, if you're on your own, you won't be bumping into things and you can find a destination.
It would still worry me, though, because there's fast-moving objects that might be coming towards you that you wouldn't be aware of.
Well, if you're standing in the middle of a subway track and it's train time, yeah, I think you'd be flattered.
Well, things can turn corners on you.
Oh, not good. But they've done some wonderful things. There's actually implants that help some blind people see. Yeah, amazing. Okay.
Oh, am I gonna talk about bandaging a dog?
Yeah, you're a dog person. I'm a dog person.
Okay.
Doctor?
Okay, how do you
I
bandage
don't have
a
dogs,
dog?
but I love dogs.
Oh,
yeah.
We
Well,
love
Dr.
dogs,
Belzik, you're a dog person.
No, we have fish.
Oh.
He's the cat person, I'm the dog person, you're the fish person. We got to balance it out here.
Yeah, that's true.
Yeah, okay.
Well, dogs have owners, cats have staff. It's a whole different thing.
Yep.
So, bandaging your dog.
Okay.
And
how
by
to
the way, you
bandage-
have two lovely dogs.
Yes,
You do.
it's how to bandage an injury or perform CPR on a dog.
Oh,
Because things can happen.
They love
First
that.
of all, you have to stay calm because the animal's going to be upset in the first place, and you getting upset isn't going to do any good. That's hard to do because it's like we're dealing with a child. So, for a wound, take antiseptic on a cloth or pad and wipe it off if you have it available, and then use water to wash off the antiseptic so it doesn't get irritated. Don't use soap. Just clean the wound, and then hold pressure on it with some gauze or cloth or whatever for 3 minutes. And then have some of the stretchy rolled up elastic tape around your house, because my dogs don't go out that much, and you should have some in your medical kit in the car anyway, that elastic tape. And when you go to bandage a dog's leg or whatever, you want to stick your finger in there so you don't make it too tight and cut off their circulation. So that when you pull your finger out, that it still works for them. So that's just a good thing to do. And when it's all wrapped up, you pull it out, and it's good. And CPR is another thing. You lay the dog on its side, and you check inside. You check the pulse on the inside of the thigh, the lower thigh. You can, or I guess, would it matter what thigh, doctor? I don't know.
Probably not. No.
Okay. And to see if the heart's beating, you extend the dog's neck outward. You've got to make sure there's nothing in there that's blocking their windpipe, and pull their tongue out and hold it out. And then compress 5 times on the chest, and then put the tongue back in the mouth, close it, and breathe through the nose.
Where do you find all of this?
I don't know. You're supposed to repeat
amazing.
this like 100 times a minute. For a dog, they have a very, their heart beats faster.
Quite
and
rapid,
everything.
yeah.
So the question is then, because that's handled, we know how to do CPR now. Let's hope we never have to do it.
Right.
Okay. Can you get sick from a dog?
Boy, it got
I would
quiet
think
in
I
here.
know. I know.
Tell us.
But the thing is
would think you
that
could.
if someone is sick and shedding a virus and has been petting the dog, perhaps you could get sick from the dog. So wash your hands after you pet the dog anyway. But dogs get a lot of the same diseases like flus and colds, but we don't pass them back and forth. So they can't pass them to us. So can you get Ebola from a dog? Well, that's been a question lately. They put one
dog was quarantined,
One
sure.
dog was put to sleep too.
Oh.
Yeah, because they weren't sure what to do. The authorities, it was euthanized. So the dogs can make antibodies to the Ebola virus, but they've never been able to find Ebola virus in their cells. So it's like they don't know if they get a flash infection and build antibodies right away and it's gone, or if they shed the virus for a period of time. So dogs have the antibody, but they don't get sick. So can they transmit something they don't have?
Yeah.
No.
Probably less likely.
I don't know.
Moving on.
Yeah.
It's a great report. Amico. It's a device that helps people track using inhalers. Now, Dr. Belzik, I know you and Dr. Body have run across this frequently, where people are supposed to take medicines and they don't. Go ahead, Doc.
No. Sometimes they just don't remember. Sometimes they need help remembering, or they can't find the bottles. There's many reasons.
Well, if you use an inhaler, this Amico device attaches to commonly used inhalers, and once paired with a smartphone or a standalone hub, it automatically keeps an eye on when you take the meds. So there's a gyroscope. So when you go to inhale, it triggers, so it knows. And if you're not taking the device, lights flash, people appear with cameras and a band, marching band. It's quite a thing. But it could at some point notify you or your caregiver or your family. So you call up and say, Dad, you're not using anything. I'm using it. No, you're not.
My dad would love that. He doesn't have to use one, thank
ask
God.
Dr. Bruce, Dr. Hensel, who by the way, I know him. He's a nice guy. We doing that?
Yeah, go for it.
Okay, wait a minute. Didn't we have did we do the tug test already?
No, we didn't. That's Dr.
No, but let's
Belzec.
hear about Dr. Bruce. I want to hear what he has to say.
The tug test. I think
Yeah, I think it's the tug test. Let's do that.
You want to talk about Tug or Bruce?
tug.
Tug.
Well,
And
what
we
is-
only
what
got
I want tug.
we only have 3 more minutes. What's the
Oh,
tug?
All right,
should we do
tug-
something quicker
No,
then?
Tug stands for Timed Up and Go Test. It's a simple way to assess a person's mobility and chances of falling. But this test involves a person getting up, walking. Trained specialist watches them, but it's very qualitative. It's not quantitative. So this company, Kinesis, has developed a quantitative timed up and go system that turns this to a quantitative test. There's 2 devices with accelerometers and gyroscopes built into each or attached to each leg.
In other words, you get wired up.
You get wired up. This
Yeah.
information gets to a tablet, and sensors monitor and record the way the legs move during the test. So it's very helpful. Gets sent to an app, interprets it, and it's now available in the U.S. and Europe, and used in clinical facilities, and physiotherapists are using it.
Well, here it is, folks. This is Bonnie Jane Bentley. And she's got a plug-in. When do you see this? Doctor, you must be wondering what that is.
Yeah.
Yeah, I am too,
It's
but
not
I
like a
happen
regular bicycle helmet or something.
Well,
no.
this one's kind of
Looks like
special.
really fancy.
We're going off script or what?
Yeah, I think we're. Look at that. Look at
Is it
that.
rolling off? Oh no, it unplugged again. We don't have an extension cord.
Oh, okay.
Was
Well,
it-
we
was it
saw
working?
you flashing red
I'm
lights.
flashing red lights. Yeah, this is the iGrow, and we're
Oh,
going to be
the
talking about
iGrow.
it first thing
Remember
on the
that?
next show. And it's a hair growth system with 55 LED and red laser lights.
And it's got a
Does it
track record, Doc. It works.
I'm going to be needing that soon.
It works.
Yeah,
great.
you
It works
you
great.
you need that.
I will, at the rate
Hey,
I'm going.
Doc, the way I blow dry is like that. I wouldn't worry about it.
Well, I've been using women's Rogaine for years, and because we have this male pattern baldness in our family, and this thing seems to be really filling it in. So I'm very happy, and I don't have to put that stuff on twice a day and have it run where I don't want it.
How often do you have to wear it?
You start out 3 to 4 times a week, and then you go to twice a week.
Okay.
I think we're about ready to wind down. We want to thank Dr. Bhatia
Yeah,
for
thank
staying
you.
with us, for joining us. Give your information again.
Yeah, I'm located at 4940 Van Nuys Boulevard, Suite 200 in Sherman Oaks, across the street from Sherman Oaks Hospital. And our phone number at the office is 818-528-1260.
And while we're doing that, let's make sure we know about Dr. Belzic's practice.
Dr. Ronald Belzec at the Amputation Prevention Center at Sherman Oaks Hospital.
A member of the Prime family.
Exactly.
I think we're just about done. So we
I
have a lot of
guess
material
so.
for next week, but
Oh,
stay
yeah.
tuned because on the tech show we have some amazing information. We always
yeah,
do.
lots of stuff.
We want to thank Sam, LA Talk Radio. Hi, Sam. Make it all happen. And we'll see you next time. Thanks for joining us. I'm Jeff Levy.
Bonnie Jane Bentley.
Dr. Ronald Belzec.
We'll see you next time. Take care. Bye-bye.
Bye-bye.
Now, what I need to do is I need to move the mouse and turn the program off.
Did you turn off the mic?
You're listening to Up on Medicine with Jeff Levy, Bonnie Jane Bentley, and Dr. Ronald Belzec, right here on LA Talk Radio.